So I have been a respiratory therapist for 30, going on 38 years, which is kind of wild because I look so young. I'm the director of respiratory therapy at Henry Ford Hospital in Detroit. Work with an awesome group of people. We are an urban setting here, so we're in Detroit, level 1 trauma center. We do transplants, 850 some beds. Quarter of those are ICU. It's a happening place. I'm married, have 4 children that are grown, and have a couple grandbabies. So that's me. And I love this field because we do great things. RTs are vital to our healthcare system, absolutely, on a national level, on a local level, on a personal level. I myself am an asthmatic. I've often said that most people don't know what an RT is, a respiratory therapist is, unless they've needed one. And then they are very acutely aware of who we are and what we do, up until COVID. With COVID and this being a respiratory illness, we have come more into the forefront, kind of out of the shadows. We were always the hardworking, in the background, collaborative people, which we still are, but now people know we're there. It was pretty hot in Detroit area back in March. So we just kind of launched right in, and each day things are changing rapidly. You know, you're getting more information. The most important thing for us is how do we take care of that patient? Huge, absolutely. The other thing that is hugely important, especially me as the RT director, is how do I take care of my people? Like, how do I make sure our therapists aren't being removed from the equation because we put them in a situation where they get sick? You know, we talked about that in our huddles, and we said, you protect you first. You take 15 seconds, 30 seconds, whatever it takes to get your gown, your glove, your mask, your hat on, and then go in, because that 30 seconds isn't going to make that patient do any better per se. But when you get in there and you can focus completely on that patient because you're safe, that's hugely important. And we were, a lot of times, those first people in the room, because we were respiratory therapists. Before there were rapid response teams, we were the rapid response team. We were there, that first person in. We had to start thinking about things like gas flows and where might we put a viral filter, and all of those kinds of things we had to stop and think about again. Everything we knew, we questioned. Networking is huge. And so we had folks like our education people for the colleges who are now, they're furloughed. They're not working at the colleges. And we're like, what can we do to help? We feel terrible. Well, they were our research department, right? I would call up Nick Prush from U of M, Flint, and say, Nick, I need to know everything about this. And he'd say, cool, I'll get back with you. And then he would. Everybody was willing to help because it all made it better. Everybody wanted to help. I'm very passionate about our field. I love it. I love what we do. I love the impact we have. It's real easy to let it get to you. Like sometimes with COVID, one of the things we didn't talk about is when you have multiple deaths, right? You have patients, you've done everything you can possibly do, and your docs and everybody's like, and they die anyway. A patient dies anyway. Well, there's only 2 things that are true that will happen to every person. You're going to die and pay taxes. And I always say I try to avoid both. So we have to realize that patients do die regardless of what we do, right? With COVID, because of the intensity level, we saw a lot more of that in a shorter amount of time. We saw huge amounts of successes, and we had to make sure that we shared those successes. The music in a lot of places, here we did, if somebody did well and went home, music played, right? That was cool because you're like, okay. And then you started to hear the music all the time, and it's like, all right. So you may have a couple patients die on your shift, and you go, okay, and then you keep going, but it wears on you. So you got to make sure you're taking care of yourself. with that self-care, but also realize all the good that we do as well. So if you're thinking of becoming an RT, do the work, learn. Respiratory therapists are very hands-on people, but there is that huge didactic component and that thirst for what's new. We can't live where we were. If that was the case 38 years ago when I graduated, I would have just stopped learning. I learn something new every day. So if you want to be in a field where you can continue to learn and grow, this is it, right? And you want to do the work, you want to learn, you want to put yourself out there, this is your place.